we have another patient that wants to talk. And she is actually another breast cancer case, and she is retired, but she's a doctor. And we call her Dr. Evelyn. But she's retired, but she is a doctor, which means, and her husband is a doctor retired also, so means that they understand a lot more about what we do, a lot more than the average public. Evelyn, are you there?
Yes. Hi, Dr. Carpenter.
Hi. How you doing?
I'm fine, thanks.
Okay. Well, go ahead. Tell your story and how you found out about us, what you decided to do, how you were unsure at first about coming, didn't you?
Well, I did a lot of research, and I'm kind of an analytical person by nature, so I did a lot of studying, and when I came to you, I think I knew that was where I was supposed to be. But I'll go ahead and start out. As you said, both me and my husband are physicians and surgeons, and so when I found out about my diagnosis, I had done everything that medically was supposed to have been done. In other words, in my situation, it was breast cancer. I had the yearly mammograms for approximately 10 years before being diagnosed, so that was all consistent with what the medical people tell you to do. And then on the day that they found the mammogram was abnormal, they told me that most likely it's nothing, but you need to have a digital mammogram. So I went back again and had another digital mammogram, and again, too, they said that they found some abnormalities and they would like me to have an ultrasound. So I went back a third time, had the ultrasound. They said it still looked a little bit abnormal, but most likely it's nothing, not to worry about it. And of course, by this time you're quite worried about it. And went back after the ultrasound, and they said now you need an ultrasound with a biopsy. So by this time you're pretty shaken up and you really don't know what to anticipate. When I did show up for the ultrasound with biopsy, they had me sign a consent form, and I asked the gal who was in there, the nurse who was assisting, what possible complications of signing this piece of paper would there be to just have an ultrasound with biopsy. It sounded pretty straightforward, and the only thing that she mentioned was that she said it's a very, very extremely rare thing that could happen, but she said, I guess the worst thing would be we could puncture your lung. And I thought, oh my goodness, that sounds awful. And she says, but let me reassure you that I've never seen it happen. It's nothing that could possibly go wrong, and really there's nothing that is to be concerned about, so just go ahead and sign the form, which I did. Well, halfway through the procedure, I realized what a barbaric, my specialty being surgery, I guess I didn't have, nobody ever does, has the full knowledge of what goes on in anyone else's specialty until you actually go through it. And to have a ultrasound with biopsy, what they do is they take this long, they call it a core biopsy. It's a needle, but it's on at the end of a long metal rod. And this long metal rod is then shoved into your breast, and he tries to find, in my instance, it was a 2-centimeter mass. He tries to find this mass with the needle, puncture it, and what I later found out was that the harder the mass, supposedly, the more indicative it is that it is indeed a cancer. So he's trying to ramrod this little bitty needle into this very hard jelly bean mass, if you can picture it, and get a sample of tissue. Well, he tried about 3-4 times and slipped every time. I could feel the needle give, and I could feel him press against me as it slipped off its target. After about the 5th time, he finally tried to stab it, and he again missed, and he again slipped off his target, and I screamed. It was extremely painful. And immediately, what does the doctor say? But he says, you better prepare an x-ray. I think we punctured her lung. So okay. Here was exactly what the nurse... Do you have to go?
We got a break. Yeah.
Go ahead.
We got a break coming up, so we'll got to stop for now, and we'll come right back. Okay, stay on, and we'll continue this, because this is very interesting. We're back, and go ahead, Dr. Evelyn. Go on with your story. Everybody's anxious to hear this one, even the board operator.
Okay, so I was saying that the radiologist who was doing the core biopsy on my breast for the tumor that he found, that he suspected was there, slipped, and when he did that, caused a great deal of pain in me, and the nurse who had told me that this is very innocuous procedure, there should be no pain involved, and it should be very easy and very straightforward, and the worst possible thing that could happen would be puncturing a lung. here the doctor, after he hears me scream and just about wrench off the table, tells me, we've got to go ahead and transfer you to X-ray immediately because we think we punctured your lung. So again, too, I'm only belaboring this first part of the diagnostic procedure because I think there were so many mistakes made that it couldn't help but open my eyes to the fact that, we really don't know as much as I think a lot of the TV commercials and the Relays for Life and all the people who are promoting, let's find a cure for cancer, and let's raise a lot of money for this. I really question that because I find so many things that are just not consistent with a true diagnosis of an intelligent nature that can be made of this thing. It just seemed like there were so many mistakes made in my case, and as I talk to others in their cases also, that lead us to believe that we really don't know as much as we're being told is being known about cancer. Anyhow, so I'll just belabor this a little bit more and get more into the treatment issue of it, but it turned out that they did not puncture my lung. When I asked the doctor how much more do we have to go through, he says, no more, I'm stopping right now, I can't do this anymore. And it's not like I do live in a somewhat of a small town, but it's not like this was not a well-known, well-respected hospital, and I thought, my goodness, if this happened to me, how many others does it happen to out there where the radiologist just gives up because he can't do a procedure that he is supposedly scheduled to do? So that raised a big question mark to me initially. That was one of the first things that made me raise my eyebrows about how cancer is diagnosed and treated and how the patient is taken into account and treated. So that was the first thing. Second thing that happened to me was that I was told by the radiologist after I left the ultrasound room that he was not able to get any specimens. He says, I'll send in what I have here, but I really don't think I got anything. So just get yourself to a surgeon. Because of its hardness, we're going to assume it's cancer, and you better just go see a surgeon. And that was the end of it. I had to walk out of there not really knowing anything, in severe pain. My breast was bright purple, like a grape, for about a month afterward because of how he had slipped and had torn at me internally. So I went to go get my records so that I could then make an appointment with a surgeon. Well, I went to go get my records, and the girl tossed me a piece of paper. She was on the phone with a girlfriend and really didn't pay me too much mind. And I asked for the report of the ultrasound, and that's what she gave me. And then on second thought, I went back to her and I said, I hate to disturb you, but I said there's an outside possibility that there might also be a specimen from the lab in case he did get anything. Well, she looked and looked and looked and was a bit annoyed with me, but finally did find a piece of paper, tossed it to me, and closed her window for lunch. And that was how I found out I had cancer, was just having this piece of paper thrown at me, and I had to read for myself, invasive ductal carcinoma. So again, too, I thought, my goodness, if this is how people are being told worldwide, countrywide, that they have cancer by a piece of paper being thrown at them without any indication of, this is the severity, this is where you go, this is what you do. And that was my indoctrination to, being diagnosed with cancer. So that was another thing that just made me appalled at how a medical facility and medical professionals are handling the issue of cancer. So another segment of this goes on now is I try to find myself a surgeon, and I try to do all the research and ask around and find out the leading surgeons in my area. Well, I came up with two, and I thought, well, I've always been told to always get a second opinion, so I'll book an appointment with both, sit down, hopefully finally have this consultation of someone explaining to me exactly what I have, where we go from here, and what the scenario is. And I booked my two surgeons. Well, the first doctor's office called me and said, now, we're the only surgeon that you're going to see. Is that not right? And I says, it is not right. I have booked a second one. I have two opinions going for myself, and from that I'll make my deduction. Well, they said, no, that was not allowed. And in this doctor's office, who was supposedly the best surgeon in the area for a town of about 40,000, 50,000 people, he says, we do not allow second opinions. Well, being a surgeon myself, that just absolutely made me aghast, because I always encourage patients, get a second opinion. Make sure that what you're doing to your body is something that you fully agree with, you fully understand the possibilities and the ramifications and the setbacks before you make an opinion. So that was just appalling to me. When I told them I intended to keep both surgical opinions, they said again, too, this is not allowed in our office. Either you go with us or you don't book an appointment, period. And I said, well, I'd have to think about that. They had asked